In this video, we will show you how to safely use the HoverMatt single patient use air transfer mattress to prone a patient. Please review the HoverMatt air transfer system training video for detailed instructions and information before using the mat. Follow your facility's process for safety during proning. Make sure there are at least 5 caregivers present for this task and identify the job of each. You will need 2 caregivers to turn the patient, 2 to receive the patient, and 1 to manage the airway and guide the patient's head. If applicable, max inflate the low air loss bed mattress. Place the air supply on the sending side of the bed. Select the proper size HoverMatt for the patient. For demonstration purposes, we're using a 34-inch HoverMatt SPU. If the HoverMatt is not already present, place it underneath the patient using a log rolling technique. If you are the caregiver at the head end, position the patient's head appropriately for the turn. Use a pillowcase to secure the patient's arm on the receiving side. Place the hover cover on top of the patient, then place any pillows or positioners off-center on top of the hover cover toward the receiving side. Next, place a second HoverMatt on top of the patient, bottom side up. Fold the top of the second HoverMatt down to expose the patient's head and align on the sender's side. For reference, this is the side opposite the ventilator if you are using one. Next, tuck the patient safety strap between the mats. Secure the air supply hose to the bottom mat on the sender side. Caregivers on the receiving side will then roll both of the mats together and grasp tightly. Make sure the patient safety strap is rolled in with the mat. On the sending side, caregivers will grasp the handles of both mats as well as the sides of the mats with palms facing up. Before moving on, the caregiver at the head end must verify the patient's airway is secure, then direct the mat to be inflated. Once the HoverMatt is fully inflated, position the patient toward the sending side. Senders should then begin lifting and pushing the mats with the patient toward the receivers. Initiate the turn. The patient's weight will create momentum. Allow this momentum to help prone the patient. Once the patient is in the prone position, turn off the air supply. Remove the hose, unfasten the mats, and remove any mats and pads that are on top of the patient. If necessary, reinflate the bottom mat to center the patient in bed. Make sure you follow your facility's process for safety post-proning and store the HoverMatt for later use. Follow the same technique to turn the patient back to supine.